Good morning, everybody. This is Rick Marr, and thank you for joining us this morning. Hope everyone is safe and well. So we're going to get started, and you may or may not hear, they happen to start doing the landscaping outside my office window about 5 minutes ago, so hopefully that passes shortly. So again, thank you for joining us this morning. This morning we're going to take a journey which mirrors the roller coaster we've been on these past few months. Over the next 25 minutes of this presentation, and then with the question and answer session at the end, we're going to share with you how our clients are ending their roller coaster ride and returning to work through a comprehensive PCR vial and antigen testing program, coupled with an employee tracking component. There will be a lot of information, so we're going to record this session so that you may be able to return to it or share it with colleagues. The recording will be posted later today on our website, which is, as you can see on your screen, turningpointhcm.com/webinars. As mentioned, we will have a Q&A session at the end of this presentation. So please use the chat function or the Q&A function on your screen, and we will address all of those questions at the end with our panelists and partners on this journey from Heed Health. Our panelists, so let me introduce myself. My name is Rick Marr. I'm the CEO of Turning Point Human Capital Management. We're a fractional human resources consulting firm based in Coram, New York. We are focused on first or second generation family businesses with a handful to several hundred employees. And we solve many HR problems for those businesses, including compliance issues, which I think will uncover some of those things today, employee issues, right? So I think that's going to be very obvious as we go through this presentation. Policies and procedures, as you can imagine, many of the things that we have written and do now might need to be updated after this is all over. And then the fourth is strategic stuff, right? So again, this program that we're going to talk about is also very strategic for, how we all conduct business for the foreseeable future. So I'd like to thank my panelists here and guests, and I'm going to introduce them. And they will be speaking again and answering questions at the end. So for Heed Health, the Chief Scientific Officer is Dr. Daniel Sahlein. Dr. Sahlein received his medical degree from Albert Einstein College of Medicine in New York City. He completed the NYU Langone Medical Center Triple Boards program from September 2011 until June 2014, completing 2 residencies in neurology and radiology, as well as 2 fellowships in diagnostic neuroradiology and interventional neuroradiology. Dr. Sahlein, can everyone hear me? Okay. Dr. Sahlein was an assistant professor of radiology and neurosurgery and neurology at Columbia University Medical Center for 3 years. So the next guest is the chairman of the board of Heed Healthcare, Dr. Eric Schweiger. Dr. Schweiger is the founder and CEO of Schweiger Dermatology Group, the largest dermatology practice in the Northeast, with over 60 offices throughout New York, New Jersey, and Pennsylvania. Dr. Schweiger received his medical degree from Albert Einstein College of Medicine in New York City and did his postdoctoral training at New York University and University of Kansas Medical Center. Dr. Schweiger currently serves as Associate Clinical Professor of Dermatology at Mount Sinai Medical School in New York City. And also we have with us Brian Stern, who is the Chief Executive Officer of Heed Health. Brian is a founding partner and managing director of Diversified Private Equity Corporation. Brian has spearheaded the company's investment activity and growth over 12 years. Prior to that, Mr. Stern was a founding partner of Diversified Biotech Holdings Corporation, where he was part of the original team that successfully launched 2 funds, VC funds and hedge fund. These funds were responsible for numerous biotech startups focusing on oncology and cardiac indications. Mr. Stern holds his BA from New York University. All of these panelists will be available for Q&A at the end of the session. So now with that being said, let's begin. So, what just happened, right? So many of us feel like we have whiplash. We went from hearing something on the news in December and January that was happening in China to watching people sing in unity from balconies in Italy in February to a total shutdown of the United States in March. The national emergency, President Trump declared a national emergency on March 13th, 2020. Doesn't that seem like a million years ago? We are almost 2 months to the day removed from that declaration, and look how our lives, our businesses, and our expectations for the future have changed. Dealing with the shutdown, on March 27th, 2020, Governor Cuomo announced the shutdown of New York State, and many other governors quickly followed. What we were worried about at that point in time, back in March 27th, 2020, there was a huge concern around telecommuting. The questions for many business leaders was, could we do it? How do we do it? And all those other types of technical questions. We even did seminars on this topic on telecommuting on March 19th and March 23rd. Additionally, I was interviewed on that topic, and you can see a little clip from that news article there. For business owners, one of the most interesting topics, or several topics, and I would argue the most talked about topic in the business world from March 27th on, there were only two questions business owners wanted to know the answer to. After they figured out if they were essential or not, the two questions was, can I get a PPP loan, or a payroll protection plan loan, or the EIDL, the economic injury disaster loan? The SBA all of a sudden now became our best friend. We all spent days, hours, and what seemed like years thinking and talking about these two types of loans. Now, finally, the next worry, which kind of leads us to where we are today, are two fears: the fear of another shutdown and the fear of not reopening our businesses. What we've been hearing from all of our leaders in business and in the daily press conferences from politicians was that we need adequate testing to get back to work. We need the ability to detect hotspots. We need the ability to monitor our employees, to give them a safe place to return to work. We need to assure our clients that if they work with us and our teams, that they will be safe. So out of this came a new word that we all started to use each day, and that was antibody. We started to ask ourselves and wonder out loud, do I have the antibody? Have I been exposed? Am I immune? And is there such a thing as herd immunity? So as business owners, when there is this uncertainty, there is this fear of another shutdown, counterbalanced by the fear of not getting their businesses back to work. So what are business owners dealing with? What are their struggles? Time is lost, right? These past 2 months, although big in the scheme of things, it's only 2 months. But think about those 2 months. Budgets have been blown. This affects so many things. Think about the revenue targets that are going to be missed this quarter, that are going to be missed this year, and maybe even missed next year. All of the momentum that our businesses have had has been stopped. So how do you restart that machine? To take this a step further, think about all the assumptions you made when creating your budgets. You use those assumptions to set a course. You use those assumptions to think about, how much material do I need to buy? How many employees do I need to hire? How many sales do I need to support that? And on and on and on. All of those targets have been missed. So now think about your assumptions going forward. Are those old assumptions still valid? What are the new assumptions going to be? And how are you going to measure, right? How are you going to track what is happening? This is a big unknown and a tremendous fear, which can paralyze employers. So from products and services, many companies are now questioning whether all of their products and services are still needed. In some cases, yes, and in other instances, no. Some business leaders are looking at new services that they could be offering. These are all dramatic shifts that are happening in our businesses. And the backdrop to this is the unknown of, will there be another shutdown? Or what happens if my workforce gets sick? When is the right time to start selling? This is the balance that we all struggle with. We do not want to seem insensitive, but we have to generate revenue. We are all like race cars stuck at the starting line with our engine revving. So from an employee perspective, when is the right time to bring those teams back to work? How quickly can they get restarted? For many business owners, there have been furloughs, there have been layoffs, hours have been reduced, and salaries in some instances slashed. The human component is going to be a big challenge for business leaders. Think about this. Can you find all of your employees? And what if you cannot bring some back, some of your key people, right? Think about the HR stuff, recruiting, onboarding, retraining. These are all big boulders that have to be moved. With that being said, what does your team look like when we come back? Do you need the same number of employees? Do you need new skill sets? And what can the budget afford? All of these issues that business owners have to deal with all happen in the dark because we don't know about the health of our employees, the assurance that we can give our clients about our return to work policies and procedures, and how we can use, business owners can use this to their advantage. So how do we get back to work? Let me just look at this here. This is the question politicians, business owners, and employees have all been asking. For many, this is a paralyzing thought. As discussed earlier, there are so many things that need to be done and some new things that need to be added. It's like social distancing. I think to myself, what was life like before this was even a term? But now businesses and a society, we have to deal with it. There are so many areas where we have to be in tight spaces, like a crew of employees out on a truck or on a job site or in a smaller office. How is your office space designed? And there are so many implications of social distancing that have not been completely explored. There will probably be some new terms that come out the next few months. So think about PPE, personal protection equipment. This is another term that many of us have never used before. Now it will be required in all of our businesses. So can we get the PPE we need? Where do we get them? How much will it cost and how much will that cost add to our business? How many do I need, right? So I don't know, do I need one for every employee? Do I need 1,000? What if employees will not wear them? On and on and on. These are all new things that we have to deal with. The next thing is think about testing. We've heard many of our political and medical leaders telling us that we need more testing before we can get back to work. Think about the economic realities of not having any testing. Will employees feel safe returning to work? Will new projects and sales come about in an uncertain time? Will business leaders make investments without clarity as to what is going on in their world? Another thing to think about, if an employee gets tested on their own, does their employer feel safe that it's good enough? As we all know, testing without daily monitoring is not efficient enough, as the infection is everywhere. The only real solution to this problem is an employer-sponsored testing and monitoring program. So these are all things that we're now dealing with that we never thought about before. And with that, I'm going to turn the presentation over to Brian Stern, the CEO of Heed Healthcare. So let me just unmute him for a second. And this way we can make sure that we can give you the answers that you need, and he can explain how Heed Healthcare and the medical team on the call are bringing these solutions to employers. So Brian, I'm going to turn it over to you now. And are you there, Brian?
Actually, Rick, yes. Can you also unmute Dr. Eric Schweiger? He's going to give an overview as well.
Yes, let me just make sure. See if, Dr. Schweiger, are you there?
Yeah, can you hear me?
Yes, yes. Okay, Dr. Schweiger, if you would, please take it away
Sure.
from here.
Thank you. Listen, Rick, thanks for the great overview. You know, I'm here with Brian and Dan, and we're going to share some information and answer any questions. First, want to just back up and say, you know, as someone who runs a business, so I've been running Schweiger Dermatology with 900 employees and 250 doctors for 10 years. We've built that business, and a lot of what you said really resonated with me. That there's just been, unbelievable changes, and every day is something new, dynamic that's happening. And we personally went through the same cycle that you talked about, which was, okay, revenue's going to zero or near zero. We had to furlough employees. We had to lower people's compensation. Now we're planning reopening. We reopened. We recalled furloughs. We've thought about how do we keep our employees safe. And as this COVID-19 outbreak has occurred, as a medical leader, I think in New York, I've had a lot of other CEOs come to me and inquire about getting their employees tested or monitored, which has been the genesis of our development of HEED, and it's kind of how we got to where we are today. So within the HEED program, it's meant to be a single stop solution for companies to say, you guys handle the medical aspect of reopening the business. And employers are not generally used to having to monitor employees like this, or to keep up with the dynamic changing recommendations of the federal government, the CDC, local governments. So we look at it as that's our responsibility, and it's a way to partner with a company who's going to help you out. If you go on the next slide,
Okay.
it's important to realize that there are multiple components of our program. And I could say, ideally, like Rick said, virus is out there, and in an ideal situation, you would have somebody walk into work, they would undergo a quick test, and they would get like a machine that would say red light, green light. If they're green, they don't have the virus, they go to work. And if they're red, they have the virus and they go home, and we monitor them. But unfortunately, testing has not gotten to that level. And we have really worked on the confines and the construct of what is possible, what is reasonable for us to do, and what's going to make your employees and your clients and customers more comfortable. So there's multiple components of our program. The first one is the part where we come on site and actually do testing. So we bring nurses, we bring other medical professionals into your location, and we have a testing day where everybody gets tested on the antibody to see if they've been exposed in the past, and the direct viral PCR, which says, do they have the active infection? We tested 5 companies last week. About 10 employees actually had active infection. So we're using a lot of companies where people work very close together, like construction companies, manufacturing companies. Obviously, it works for all industries, but we got to pull them out of the workforce, send them home, and then get them monitoring. So that's the first component is let's find out the status of your employees. And our most important is the direct viral PCR test, which lets you know, do they have an active infection? Everybody wants the antibody test to know what if they've been exposed in the past, although there's no change in recommendations based on the antibody results. The second component is the ongoing monitoring. So I think it's another important piece to say that we get HIPAA release forms from all of our employees, so we can share with the employer, which is something that's not a traditional thing that happens in healthcare. So we need the employer, who's the client, to know what's going on with their workforce. Once the testing is completed, every company is assigned a nurse practitioner who's going to be their main clinical touch point throughout this process. And that nurse practitioner will email you or call you with the results, and she'll reach out to your employees, let them know the results. And once that part is complete, it starts going into the tracking phase, where we have a software where your employees will get a text message every day, and it will assess for risks of COVID-19 infection, fever, shortness of breath, changes in the ability to smell. There's a whole list of questions that goes over what they need to be doing and thinking about. And as soon as they say they have a symptom, the employer gets notified that you have a potential risk for COVID, and the employee is told to stay home. And that activates our rapid response monitoring, where our nurse practitioner will call that patient same day and give them guidance on whether they need to be retested or if it was a false alarm. And on an ongoing basis, every 30 days is the standard program. We'll come back to your office. We'll do the PCR test to determine if there's active infection, and that becomes the cadence. We come there the first day to 2 tests. Every month after, we come in and give 1 test, and we ongoing monitoring and have a rapid response when there's a positive result. So we're trying to do this in real time. The guidelines are changing. Yesterday, the governor announced that nursing homes should be tested twice per week. We've had companies reach out to us for nursing homes. We're working on updating the program for them. We are able to tailor our program somewhat, but this is the general program. I think on the next slide, I'm just going to briefly touch on the fees, and then I'll turn over to Brian at the end to go more details. But we have a fee related to the first visit, which includes a lot of the heavy lifting that happens then, and then a subsequent visit fee, and all the monitoring is included within all of these fees. We go on to the next slide, please. So some common questions that you may have are regarding HIPAA, and we do a waiver for HIPAA so the employer can know the results. If it's positive, we follow the CDC guidelines. If someone is negative, or if someone refuses to be tested, then we defer to the employer. So there's different HR ways to approach that, and Rick would be a great person to talk to on that. But some employers are making it mandatory, others are not. The tests are very accurate. I'll have our chief scientific officer speak to that, but we're talking 90+%. We're using the major laboratories that are out there, ones that you've heard of, and ones that have the most cutting edge tests. So we're not doing the actual testing, we're doing the specimen retrieval, we're monitoring the results, but we partner with big labs for that. We're seeing the test come back in as little as maybe 48 hours, and as long as 3 to 4 business days. So we tell everyone 4 business days. It's great to get tested a week before you come back to work, but a lot of our employer clients, that wasn't really an option. So they've already got back to the workforce. So it's reasonable to start it whenever it's applicable to you guys. Move on to the last slide, Rick.
Yep. Sorry.
No worries.
All right. Hang on. We're just gonna do this. There we go.
So yeah, I think it's Brian, Dan, myself, we're New Yorkers. We've been here for many years. Dan actually recently moved to Indianapolis, so he left us here. But we're New Yorkers. We want to get New York back to work. This is personal for us. We want to do what we can to help businesses. I was walking in the city yesterday in Manhattan, and every restaurant I walked by was closed. Sparse people with masks on. We know that this is not sustainable. We want to help small businesses, medium-sized businesses get back to be open. And this is the solution that we came up with. We're going to be nimble. So when the government changes, we can look to changing it. If testing becomes more available to do quicker, we're going to be on the cutting edge for doing that. And we're excited to work with fellow companies in New York, New Jersey, Northeast to get them open again and get them back in business. So I'm going to pause there. Before we go to questions, I'm going to see if Brian has anything he wants to share that I didn't cover.
Thanks, Eric. That was a great introduction of the company. I think as our focus is evolving on what companies need this most, we've clearly found a need. Obviously, there's a need in all size businesses, but the small to medium-sized businesses is really been a focal point, as we've seen that the resources that they have available to them lead them to need a company like ours in order to safely open up and work and create and open their business back up for their employees and for the customers. So, you know, we've been able to safely work with about half a dozen companies so far. And as Eric said, we've been able to isolate some positive viral testing, and you know, we're seeing some really interesting trends in the results. And I think that's going to continue as we test more companies. So we're excited to answer any questions and hopefully get to speak with you and let you know more about our program on a one-on-one basis.
Great, thank you. We do have several questions. So team from Heat Health, if we're ready, we can jump in and start asking some questions. So Adele asks, who pays for the tests, and are the tests costs included in your fees?
Right. So also, Rick, you may want to unmute Dan as well, just for some scientific stuff. So
thank you.
Okay, great. So the tests are paid by the employer, and the labs that does our work, the major labs, will pass their fees along to your insurance if you have, and the insurance will take care of the lab test. But the fees that we charge, as Eric mentioned, for the specimen collection, for the team, for the on-site, for the monitoring, for the database management, is paid by the employer himself.
Right. All right. So Dr. Sahlein, you should be open now.
Great. Thank you.
Did you have, before I ask this next question, did you have something you wanted to add, Doc? I'm sorry, I didn't notice I had you on mute. Sorry about that.
Oh, no problem at all. Yep. Thank you.
Okay. All right, cool. So the next question was, is around fees. So the fees are, it's $299 per employee for the first month, $299 per employee for the first month, and then $99 each employee for subsequent months. And that includes, you know, all the testing and the monitoring and all those sorts of things. The next question we have is from Kim. Does HEAT help create protocols for hand washing regularity and use of public equipment like elevators, sanitizer sites, cleaning desks, computers, phones, etc.?
Dan, I'll let you jump in on that one.
Sure. So, you know, we follow the latest CDC guidance, and you can find that on our website under resources. And we stay on top of that and are happy to deliver that information for you. We have not gotten involved in specific sort of on-site related protocols with respect to how to handle, you know, various individual kind of workplace architecture and so forth.
Great. The next question is from Elisa, and it's a pretty common question. So how do you assess employees for meeting criteria for the PCR testing if they are asymptomatic? Or are you concerned about false negative PCR testing if asymptomatic?
So we're concerned about false negative PCR testing in everybody. We have done a lot of research into the tests that we use, and we're aggressively moving towards using what we believe is the most sensitive and specific test, which is salivary testing. That is testing saliva. It's quite a bit more comfortable for the employee, and there's good data to suggest that it is the most sensitive way of detecting virus. So we are always concerned about false negatives, which is why we've moved away from nasopharyngeal swabs. Nasopharyngeal testing is very, very challenging. If you look at the anatomy of the nasal cavity, it actually in many cases is going to be very, very tough to actually pass the swab all the way through the nasal cavity into the nasal pharynx. Most people have a deviated nasal septum, so you have to actually pass it through bony landmarks. Unless you're a very experienced ear, nose, and throat surgeon, a lot of times those swabs are going to end up being done in the mid-nasal cavity, which is not a sensitive way of detecting virus. So we have moved towards oropharyngeal testing, just because we think that the actual sample taken is much more reliable. And the saliva kits are coming online sort of essentially as we speak, right around now. And we will be moving towards using those. There's no perfect way of doing this, but we think that the saliva is very, very sensitive. And so it's sort of the best that we can do for right now.
Great. Thank
Rick,
you.
I can just add to that. You know, when we submit to the insurance company, we're using asymptomatic screening as the code, so they know what we're doing. We're in the heart of the epidemic here, so everyone, from my perspective, has had a risk of being exposed to it. So that's how we share the information with the insurances. And I think, as Dan had said, you know, since the test is the gold standard to determine if you have the virus, it isn't like, you know, we know the exact rate of people who get tested who don't have who actually have a negative result. But, you know, there is some concern there. And that's why these repeat testing and these temperature monitoring and the software is so important.
Great, thank you. The next question is, how does this process compare with the test at home kits we are hearing about?
Yeah, so the test at home kits that were released previously are a nasal vestibule swab. So that means that the person takes a swab and they actually just swab sort of the front of their nose. The reason why we don't do that in hospitals at all is because it's a terrible test. The sensitivity is awful. It catches a tiny, tiny percentage of those people who actually have infection. And that's being done in a hospital by a physician or nurse practitioner or someone who's actually trained to do it. So you can imagine just how much worse it gets when people test at home on their own. Who knows if they're even swabbing the appropriate tissue for the test. We don't trust that testing at all. We don't think it's the slightest bit reliable. The saliva test that we'll be implementing shortly can actually be done at home, but it needs a physician order. And so that's where we can get involved to organize that whole enterprise. And then there's also just the piece of daily monitoring and knowing what to do with the result, and having easy access to a telemedicine provider to help facilitate the rest of the process and talk about best practices with respect to returning to work and all these kinds of things.
Thank you. The next question is a little self-serving towards me, so I'll take it. It says, can Turning Point help update employer handbook to include language to make testing mandatory for employees? The answer is we can absolutely work with you to talk about all your policies and procedures to make sure that they are as up to date with this new world. And one of the things that we've been saying, a new term that we maybe invented, I don't know, is we're applying logic to an illogical situation. So that would be a conversation that we should have, and we can certainly help you update your policies to meet this new world. Let's see. Thank you for that question. So what documents should an employer consider updating to address COVID-19 related issues? Again, I think this goes along the lines with that last question. Certainly, this is something we're helping our businesses with. Certainly, it's you know, there's some things that are not as black and white as we would always love them to have. So it's more of a conversation and understanding of what forms you're talking about, what policies, what procedures, and really the goal you're trying to achieve. So we can certainly, you see my information there. We can have that conversation, you know, offline directly would be terrific. Okay, the next question is for Dr. Schweiger. Did you implement this testing in your own business? Have you had to quarantine anyone?
So we're, you know, we're in the process of implementing it within Schweiger. So we are recalling people in real time, and we have had to quarantine many people. So it's been, you know, we've had lots of positives come up, and we've had people who have been on quarantine. We've also seen when someone goes on quarantine who's working there the next day, other people get very nervous too. So we're getting it very comfortable at following the guidelines and talking to patients, our employees about this.
Great, thank you. The next question is around insurance and pricing. So just to reiterate, it's the first month is $299 per employee for all the services, and then it goes, the subsequent months are $99 per employee. And the question has an additional component, which is, are there any billing for the services you provide or at the lab submitted to insurance?
Yeah, so as I said earlier, all the lab work that's done by the major labs is submitted to the individual's insurance. So for the most part, we believe that it's covered. Depending, we'd have to see your particular insurance policy, but the lab work is submitted to insurance.
Thank you. So this next question from Manuel is kind of, I'm going to break it into a component or two, and just, I'm reading it here as I speak. So an employee of a restaurant had tested positive, and the fever broke a couple of days ago, and the employee wants to return to work. All sick days were paid for COVID in the absence. Is there an allowable legal return policy, let's say 72 hours after fever has been normalized? So I guess I'll throw that to Dr. Schweiger. If someone is normalized in the fever, what's the recommended medical time where once they're kind of clean, if you will, can go back to work?
So I'm going to say we're never going to say that person, you have to take that person back and work. What we could say is they're medically not restricted from working, and the guidelines are really changing. And I'm actually going to ask Dan if he can answer this question based on current guidelines. But there are very, very clear CDC guidelines, and we stay on top of them. And I just want to make sure we're getting it right. So I'll turn to Dan if you can address this particular situation.
Sure, absolutely. So in the absence of fever, you'd also, if the patient ever had respiratory symptoms, you would need to see respiratory symptom improvement for over 3 days. And then 10 days would need to have passed since the symptoms first appeared. So that's the current guideline. That was recently changed from just this past week to 10 days from 7 days.
Okay, thank you.
So in the absence of respiratory symptoms, you just have to wait 10 days since the symptoms first appeared.
Thank you. Is this covered in all states in the United States? Can you do this in all the states?
Yeah, so I mean, the answer is yes, we can. As we've rolled this out, our particular focus has been in the tri-state area. We have begun rolling them out in other Northeast states, but we are scaling up and partnering up with affiliated physicians in other states. California is something we're bringing online now. So the answer is yes, that we are able to roll this out across the states.
Great, thank you. Margaret asks, how much time does it take to administer the actual test?
Yeah, so the test takes about 10 minutes per employee. So our project manager and our team work with the HR rep or the office manager or whoever is the representative from the employer, and we come up with a schedule in 10-minute intervals that the employee has uploaded, documentation taken, and administered the PCR viral and the blood antibody test.
Great, thank you. So the next question is from Ellen. Can small groups come together to form a bigger group to be tested at a site at one time?
Yeah, it's a good question. I mean, we have to treat every company individually because we create different databases for them. So, I mean, we do take them as a company by company basis. Now, if there was a common ground that we could come on site and test several companies at once, we could absolutely do that. We would just have to come up with the right uploading and schedule. So they're clearly they're clearly separate in the testing procedure.
Okay, great, thank you. Is there a possibility of repeated false negative testing results and then an employee tests positive, therefore exposing others?
Dan, I'll let you take that.
Sure, yeah. So, I mean, that is always possible. I think that if an employee has symptoms suggested of COVID-19, they need to be taken out of the workforce, and there's a specific CDC guideline for that, irrespective of their test. I think that for somebody who is more along the lines of an asymptomatic patient, which is, I think, more what this question is addressing, it's always possible to have false negatives. That's why it's important to use the best tests and to work with professionals who understand how the testing process is supposed to work and how samples are supposed to be taken and all of these kinds of things to minimize the likelihood of that happening. I think it's also like, that's also a little bit where wearing the appropriate protective, PPE comes becomes important, because you can dramatically reduce the transmission of the virus just through those means as well.
Great, thank you. Debbie asks, how do you handle employees who repeatedly test positive? For an example, an employee who continues to test positive after a month, what is the next step?
Yeah, that's a very, very good question. The CDC guidance on that says that for an asymptomatic patient who tests positive and who is, remains symptom-free, that they can return to work after 10 days have passed since the first positive test. So that would imply that those employees would be allowed to return to work. We at HEED are currently thinking about this and considering whether this seems like the most rational approach or whether to go in a slightly different direction. I think either way, when those people return to work, it's important both to discuss their home situation with them with respect to spreading virus to those around them, as well as to make sure that they're as safe as possible when they return to work, just in case they're still shedding virus. I'd also like to note that the whole testing positive thing can be a little bit confusing. The process that we use to test is extremely sensitive for even tiny little fragments of virus, not even the entire virus itself. And so we're still all learning as a scientific community what it in fact means when we still find virus in the airway of employees weeks or months after an initial infection. So we're staying on top of that science. We're constantly reviewing and scanning the literature, and we're coming up with the latest possible guidance with respect to challenging situations like this.
Great, thank you. We have just a couple more questions. So if you have a final question, if you could please post it. So Sarah asks, how many people can you test in a day?
It's a good question. So we have the ability to test a large amount of people on a daily basis. So it just depends on the amount of the medical team that we would assign to your particular company. So each one of our medical professionals could test roughly 40 employees per day. So you could just do the math on how many employees you have and how many members of our team we would need to assign to your particular company.
Great. The next question it comes from Julie, and it's, are you willing, are you willing to come in and do one round of initial testing without monthly follow-up?
I would like Dan or Eric to take that one just from a medical perspective.
This is Eric. I would say we're happy to talk with you and learn more about your how you're thinking of using the testing. It's something we've been asked before. We're open to it, but we just want to make sure we are providing a service that's valuable to you and your employees. So the short answer is yes, but we just want to get more details and just get comfortable with the overall plan.
I think the goal obviously is to that initial testing, we want to make sure that we're providing you with the right input for all of your employees. But the ongoing monitoring and the monthly part of the program is such a crucial component to keeping that level of safety and level of peace of mind that again, as Eric said, we can definitely do the initial testing, but you most likely we need to talk more about what your needs are, because the monthly and ongoing component is so crucial.
Great, thank you. And then we have two final questions. Tom asks, what is the liability for employers if they do not do testing? And he highlighted do not do testing.
And Rick, that may be one you want to comment on.
Yeah. So I think, just nothing is firm at this point, but kind of in the news, this is all anecdotal. One of the things in round 4 of the coronavirus stimulus package, negotiations between the House, the Senate, and the executive branch has been around employer liability. And one side is arguing that all employers have to be released of liability as it comes to COVID-19 and people getting sick and all that kind of stuff. And the other side is arguing that it absolutely must be, that the employers must be held liable if they're not putting the proper protections in place. And so I think we're seeing things like Amazon and some other places where those are in the news, and the employer is being sued, or actions against the employer because they didn't have proper testing and rules and procedures in place to protect their employees. As it stands right now, again, anecdotally, I'm not a lawyer or giving legal advice, but as it stands, the potential for employer liability is tremendously high, unless that is specifically changed in this next negotiated bill. So right now, it seems to be falling on the employer, a la Amazon. And then the final question we have, and I want to thank everyone. I'll thank everyone officially, but do you have a website I could review your company more? So on this website, turningpointhcm.com, that you see on your screen, if you go on that page, there's a big red banner that links you right to the team here. So you can look at the company, Heed Health, find out what's going on. So you could just go right through that portal and it'll take you there. So with that said, I would like to thank Dr. Sahlein, Dr. Schweiger, and Brian Stern from Heed Healthcare. I'd like to thank all of you for joining us today and spending some time. Obviously, this is a fluid situation, and as I mentioned before, we're applying in lots of these questions, we're applying logic to an illogical situation that we're all dealing with the ultimate goal of helping the country reopen and getting people back to work in a safe and a healthy manner. So I want to thank everybody again. This webinar has been recorded. It will be on our website later this afternoon. And for everyone who's been on the call today or the webinar, will receive a notification once that is up. So again, there's our contact information. If you'd like to talk about things further, please reach out to us. If you'd like to get to the website, use our website, and there's a big red banner. You can't miss it. It'll drive you right to the team. And thank you, everybody, and have a safe and healthy day, and let us know if we can help. Thanks again.
Thanks, Rick.
Bye now.
Thanks, everyone.
Thank you.